Hi everyone, this is Dr. Priyadat Patel, your go-to gynecologist from Balaji Horizon Women's Hospital, Ahmedabad. So, as far as the endometriosis is concerned, the common question is कि मुझे disease कितना severe है या कौन से stage में है? In what stage I am in? As far as the endometriosis is concerned, and based on that, हमारी fertility कितनी impact होती है? So, to answer this common question, you have to understand that for a endometriosis, there is a lot of classification system going on. Few of the classification systems are related to the mixed signs and symptoms. Few are based on laparoscopic findings. In that also there are a lot of classification system going on. But all classification systems do not match with the severity of the disease as far as symptomatology is concerned. जैसे बहुत ही severe disease हो, very advanced stage of a disease like stage 4, severely impaired endometriosis. But patient might be having a kind of a normal life, absolutely no effect as far as her reproductive system is concerned, and in few of the patient when the disease is minimal, then also patient feel severe symptoms. One-to-one correlation based on staging and severity and to a symptomatology, particularly fertility, is absolutely not possible. But as far as our practical knowledge is concerned, day-to-day experience of seeing a patient of endometriosis, we generally divide the patient broadly into 4 categories: stage 1, stage 2, stage 3, stage 4. Stage 1 is minimal disease, stage 2 is mild disease, stage 3 is moderate, and stage 4 is severe. So stage 1 minimal disease, in which we expect that very small endometriotic spots on the peritoneal surface or a uterine surface. Absolutely no sonographic findings. They are basically an incidental finding. When we proceed for diagnostic hysterolaparoscopy in patients of infertility, they may occasionally produce a pain, but generally fertility has been spared as far as the pregnancy and future fertility outcome is concerned. Second stage is a mild disease, when there is a few of the endometriotic implant, few of the adhesion formation, but permanent scarring उसमें नहीं होता है. Broadly speaking, in sonography, anatomy of the organ, reproductive organ, particularly uterus and ovaries, has been maintained, and to a per se with few of the classification system is concerned, cumulative size of endometriotic implant should be less than 5 cm. In this scenario, we cannot definitely say that fertility is impaired, but generally fertility is preserved and patient can go for a conservative management for pregnancy planning. Surgery is not always recommended, but for any reason, if we are proceeding for diagnostic hysterolaparoscopy for infertility, then we see these implants we generally excise, which will lead to a better outcome in fertility. Per se, we can say that fertility outcome is good as far as minimal involvement of the endometriosis. Stage 3, there is a moderate endometriosis or a moderate disease, in which in sonography we definitely see the endometrioma or chocolate cyst in the ovary. Possibility of tubal involvement can be there, and due to that little bit scar formation of the tissue, adhesion formation can be seen on laparoscopy. These patients are majoritarily symptomatic, particularly pain related issues. For them to go for a surgery before planning of pregnancy or a fertility treatment is sometimes have a questionable factors which determine whether we proceed for laparoscopy surgery or not. So there are a lot of factors we have to see, particularly timing of infertility, previous fertility treatments, what are the other factors which are related to the fertility, particularly in couple, male and female both, age of the patient, particularly female, and apart from that the sonographic finding, how much is the ovary involved, whether bilateral involvement is there or not, cumulative size of the endometrioma, adhesion formation, scarring, hitching of the rectum, nodules, anything is there or not. So it's basically a case to case basis. It's not always kind of straightforward decision. We generally assess overall picture and then discuss with the couple and then proceed for the surgery. But of course post surgery the outcome is good, and even pre surgery also in few of the instances we are getting a good outcome in fertility. In a stage 4 disease, severe involvement, rectal nodule, colorectal nodule, parametrial involvement, and other involvement of the deep infiltrating diseases, huge size of endometrioma, kissing ovaries, tubal involvement, hydrosalpinx, these are the kind of a disease where of course the laparoscopy is advisable. The fertility outcome after the laparoscopy is good if we clear majority of the disease. disease. We have to counsel thoroughly with the patient. Symptomatic corrections are also very good. IVF may require in this kind of a patient based on previous fertility treatment, ovarian reserve, age of the patient. But in a nutshell, our try is to give a patient pregnancy as early as possible. So yes, there is a correlation between staging or a severity of the disease and the fertility outcome, but it is always not a linear correlation. Few of the overlapping cases we are also seeing in our routine practice. But in a nutshell, after this discussion, you should understand that endometriosis varies a lot in presentation from symptomatology point of view also, and from science and sonography and finding point of view also. And the decision regarding the fertility, laparoscopic surgery, IVF is individualized. And it is kind of a case to case basis. So you have to understand that it is always not one size fit for all. If you have any queries regarding this, you can consult your healthcare provider or contact us. This is Dr. Priyadat Patel, your go-to gynecologist from Balaji Horizon Women's Hospital, Ahmedabad. Thank you so much. See you soon.